Hi, welcome back to Easy Ayurveda classes, and today we'll be studying the hip joint, that is Vankshana Sandhi. And hip joint is repeatedly asked for 10 marks in the exams, so it is very important for the BMS first year university exams. See, from these notes only I have secured distinction in my first year, so these are much more enough to write for the exam purpose. First one is hip joint. It is in Ayurveda it is known as the Vankshana Sandhi. It is the most important joint of the lower limb. Write as an introduction, then write it is the most important joint of the lower limb. Play important role in mobility, stability of an individual. For an individual, for mobility and stability, it helps more. Next, anatomically it is synovial joint, and functional it is diathesis. That means freely movable in all the direction. Freely movable in all the direction. Next, articular bones. Articular bones, head of a femur articulates acetabulum of the hip bone. Articular bones includes femur articular bones includes the hip joint, head of the femur. Femur is the long bone for that head, and acetabulum of the hip bone. See, if it is a hip bone, here we'll observe the acetabulum. So acetabulum of the hip bone and head of the femur. Next one includes the peculiarities, means what all are the unique features that are observed. It is strong weight bearing joint, high range of mobility. Acetabulum is deep, so femur head fitted properly. Tension and strength of the ligament support surrounding muscles. It will support, it holds the tension and strength. Acetabulum is deep, so femur head fitted is proper. So acetabulum is a cave like structure, in that this head of the femur is fitted properly. High range of mobility is observed over it, and strong weight bearing joint. This, if you want, you can write it. It is better if you write, because you can fill the more pages. Next one is the ligament of this joint. This is very important. In Viva also they'll ask what all are the ligaments of the hip joint. So fibrous ligament of the hip joint, that is fibrous capsule. Iliofemoral ligament, that is ligament extends between the ilium and the femur bone. Ilium is a part of the hip bone and the femur bone. Next, ischiofemoral ligament, that is the ligament between the ischium to acetabulum. Both are the parts of the hip bone. Next, pubofemoral ligament, that is triangle shape what is present in the hip bone. There you'll observe ligament, those are known as the pubofemoral ligament. Next, ligament of the head of the femur to round ligament. So ligaments of the hip bone are very important. Next, movement includes flexion, extension, adduction, abduction, and medial rotation. For flexion, psoas major muscle is involved. For extension, this is the gluteal muscle. Extension, gluteus maximus and hamstring muscle. Important, hamstring muscle for extension it is involved. Gluteus also gluteal muscle. Hamstrings muscles are the thigh muscles. Next one is the adduction. For this, adductor muscles, very easy. Adductor muscle. Abduction, gluteus medius and minimus, both muscles are involved. Next, for medial rotation, gluteus medius. For medial rotation, same muscle is again involved. Next includes the blood supply, medial and lateral circumflex of the femoral arteries. Same one from the medial prospect, another from the lateral surface. Arteries are running, so medial and lateral circumflex of the femoral artery. Next, superior and inferior gluteal arteries. Abductor artery. These two are more enough to remember. Next, nerve include, as femoral bone is there, so femoral nerve and gluteal nerve and obturator nerve. Next one is the relations that are present in the hip bone are anteriorly femoral vein and artery are running. So if it is a femur bone, anteriorly above you will get the femoral vein, artery, nerve. Posteriorly you will get medial circumflex artery and periform. So for posterior region, behind you will get the median circumflex artery, and in the superior region you will get the gluteus maximus muscle. Superior region, because here only you'll observe buttocks, no? So you'll observe gluteus maximus muscles. And laterally you'll observe lateral fibers of the pectineus also in anterior region. You can just lateral fibers of the pectineus muscle that is observed. And clinical features that are observed in the hip joint include fracture and dislocation is first one, and this for this condition sciatic nerve is affected. Next with the birth's diseases, flattening of the head of the femur. If femur head is become flat, no, that is known as a Barth's disease. Next, coaxa vara. This is important. Ask for MCQs and viva many times. That is COAXA coxa varaha. When neck and shaft angle form decrease in angle. See if this is acetabulum, and for here femur bone is as fixed, and neck and shaft angle decreased from the normal. See if it is 120 degrees a normal angle, if it is reduced to 110 degree and 90 degree of this both joining of these two bones, that is known as the coxa varaha. And this much is the information for the hip joint. Next one will be the knee joint, and that will be get to in your next video. If you like my video, please like, share and subscribe to my channel, because it takes more effort more me to create videos for you too even after my classes gets over. So consider those efforts and subscribe to my channel. Thanks for watching and keep supporting. Bye bye.